Hello, I'm Jennifer Justice Gallardo, and I'm a midwife, and I am mother to 9 children. Yes, I've had 9 babies come out of this body. And I'm coming to you today to talk to you about sciatic pain and back pain in pregnancy. And I'm very excited to talk to you about this. It's not exciting to have back pain and sciatic pain, but it's really exciting to find solutions to it. So I remember with my first pregnancy, my lower back pain was so terrible that it was really hard to sleep. And I was going to school at the time. I was in college, and I just remember all the walking I had to do and all the achy back, and I really didn't have any tips or advice on how to fix the pain. And with my second baby, I remember it actually bringing me to my knees. Like literally, I was walking to the kitchen to get my toddler a snack, and suddenly just dropped to the floor because of the most terrible pain that I got. So I also remember the deep achy hip pain that I would get at night, and I would wake up because my hip hurt so much. And then I remember just the whole process of rolling over to the other side, and then that hip would start hurting, and then I'd have to get up and roll over to the other side. So anyway, let's figure out how to get rid of that stuff and help you be more comfortable and help you just have a happier pregnancy. Okay, so first off, why is back pain a thing, right? Why does that happen, and why does it happen more in pregnancy? So you have a lot of changes happening to your body. I'm gonna grab our little pelvis here. So here's your pelvis. It's not actually your pelvis, right? But a little model of the pelvis. So here we go, and your baby's inside your uterus, and your uterus attaches to your pelvis. So you have ligaments in your uterus, and specifically, there's the uteral sacral ligaments that are posteriorly attached to the sacral vertebrae. So right in here, and that is going to pull and just make changes to your spine and your pelvis. So there's a couple things that happen besides that. One of the things that happens is that your abdomen gets stretched out to, it's called the diastasis recti. I don't know if you've heard of it. It's kind of like this zipper right here. It spreads. Thank you, baby. And it spreads and separates. It'll come back together later, but for pregnancy, it's going to separate, and that causes extra strain on your back as well. Okay, so let's start with some simple solutions. Number one, I want to make sure that you are sleeping with a pillow in between your legs. Don't ever go to sleep without a pillow between your legs. So I have a memory foam pillow I use that's very firm. If you sleep without a pillow, your leg that doesn't have a pillow in between it is pulling down your hip and your pelvis into an unnatural position that's going to cause more strain on your spine. So we want to keep the pillow in between the legs so that your spine stays open and relaxed in the proper position. Okay, so let's start with that pillow. The next little pillow thing I have over here is, I get this one on Amazon for about 20 bucks. This is my favorite one. You guys, I did all the shopping for you because literally I tried out like 10 to find my favorite. This one, I don't make commission on this, igloofortravel.com. It's my fave. It's memory foam. It's like the perfect size to keep your spine in the perfect position to help you not get back pain and not have any inflammation happening there, like that can pinch your nerves. So it keeps everything where it's supposed to be. All right, so now I get to my favorite part. I'm going to share with you some solutions that are based on topical use of essential oils and some internal supplements. Okay, so first let's start with supplements, because we always want to make sure that we have the nutritional foundation that we need and the nutritional support we need. So specifically calcium, magnesium, and you're going to hear me talk about calcium, magnesium a lot because magnesium is so crucial in pregnancy, and we're not getting enough of it through our food. Our soil is actually depleted in magnesium, and there's different types of magnesium. We want to make sure you're taking the right kinds. So I'm going to talk to you about a few that are better than others. And my favorite is the Bone Nutrient with doTERRA. And it has the magnesium ascorbate combined with vitamin C for better absorption. And it doesn't cause stomach irritation, so it's gentle to use in your pregnancy. And another benefit of magnesium ascorbate is that it rids the body of calcium that's been deposited ineffectively. So you want calcium to go to the right places, right? You want it to go to your teeth and your bones, and your muscles need it too. You don't want it going to your placenta and to your arteries and other places. Okay, so this is a really good magnesium calcium that you can take. There are some other good magnesiums on the market. So for example, magnesium citrate. There's one that they call Calm that you can get and put it in your drink. And then there's malate and glycinate. So just make sure that you are taking a good quality magnesium supplement. So your muscles will thank you, and it also will help you not get leg cramps, but that's a different video, okay? So, okay, my favorite part, we're gonna talk about what you can put on your back and your muscles for relief. So let's start with topical. And, okay, first off, we're gonna help your muscles relax with Deep Blue Rub. And I had a mom come in recently, and she called me, and she was actually going to go to the emergency room. She was in so much pain. She thought something had to be abnormal, wasn't sure what was happening. And anyway, I had her come in first to see me, and I put the Deep Blue on her back, and her pain, that side back pain she had, went away immediately. And she was so relieved. So Deep Blue Rub, I promise you it works. I have, I have teenagers and a husband and all kinds of kids who love Deep Blue, and they steal this one, and then I can't find it. So I have a big tub that sits on my desk because I use it a lot. I use it a lot, and I'm not pregnant. So, okay, Deep Blue Rub. Now, let's talk about oil layering. This is when you use more than one oil, and you just put it in layers, and it works really well. I had a mama who came in, and we were talking about back pain and what she could do, and she was saying, tell me, I always ask my clients how they're sleeping, and she said she can't sleep. She couldn't sleep because her hips, that hip pain we were talking about, right? So I was just like, oh, Mom, I'm so sorry. Just let's take care of that right now, because her hips were even hurting then. She's like, my hips, they just won't stop aching. All right, I told her about the calcium magnesium and starting to take that. And then we did oil layering. And what that is when you use more than one oil and you put them on in layers. So I started with copaiba and Deep Blue oil, not the rub, but Deep Blue oil. And Deep Blue, y'all, it's incredible. It has a combination of essential oils that work synergistically, and it's practically magic. So I just love, love, love Deep Blue. It has, if you notice, a big cap on it that you have to push down and press and turn. That's what doTERRA does with the oils that you cannot take internally. So they're like, don't take it internally. It has wintergreen in it, which you don't want to be taking internally at this time, especially when pregnant, because it's a blood thinner. So, but you can use it safely topically, and it's a beautiful thing. So then you have your copaiba and frankincense. And copaiba and frankincense, I have a deep love and appreciation for these and how amazing they are. And frankincense, this one, it comes from Somaliland, from a tree, the resin of a tree. And copaiba comes from a tree in the Amazon rainforest. And both have so many healing properties that if I was on a deserted island and they told me I had to pick just a couple oils, these would definitely be the top. You can take them internally, and you can put them on topically. We're talking about topical right now, right? Okay, so this mama, when she came in, I did 3 drops of copaiba, 3 drops of Deep Blue, and 3 drops of frankincense, and I just rubbed, I did one at a time. 3 drops, rub it on, another 3 drops, rub it on, another 3 drops of the other one, rub it on. And then I layered it on top with Deep Blue Rub. And she reported to me that the pain went away, like the pain she was having right then in that appointment went away, but also that she just slept like a baby, that it was amazing for her. So It works. And 3 reasons I choose to use essential oils in my midwifery practice and recommend them to my clients are: 1, they're 100% natural and safe. 2, they're more effective than many medications. And 3, they're cheaper than traditional medical care. So I really love them. Okay, now we're going to talk about healing internally, so from the inside out. And we've got what we're going to use topically. We've got the little tips and things we're going to do as far as pillows go and good posture. So let's talk about internally, what we can do internally. So first off, I have the deep blue polyphenols. And polyphenols are super antioxidants. They help to stabilize and neutralize oxidation in the body. And oxidation leads to inflammation, which also leads to aging and feeling terrible. And by increasing the polyphenols, not only will it help your back feel better, but this is a secret, it helps you have brighter, younger looking skin. And it also supports your immune system. So these have frankincense in them. Remember, I said you can take frankincense internally. This has frankincense in them. It also has ginger and resveratrol and some other awesome ingredients full of polyphenols, which are amazing for your body. Okay, remember we talked about copaiba, the essential oil. So now we're going to talk about copaiba internally. And doTERRA has it in a soft gel cap to make it easy for you to take. And copaiba has I can never say this word, beta-carotene in it. Okay, what it is a cannabinoid that interacts with your body's CB2 receptors. And it's the key that fits into the lock of the CB2 receptors and turns the body on to a greater state of balance. And we all want balance, okay? So if that went over your head, don't worry. Just remember that copaiba supports many of your body systems: cardiovascular, skin, immune system, nervous system, and most importantly for what we're talking about today, it lowers inflammation. So your back will thank you when you take 2 of these a day. All right, so 2 of the deep blue polyphenols, 2 of the copaiba. Last but not least, we have turmeric. And most of you have heard about turmeric and how powerful it is, but the doTERRA turmeric is different. I'm going to show you why. Look at this. You see this capsule? Where's the camera? Okay. Hey, it matches my sweater today. Ooh, I did not plan that. However, this is super cool, you guys, because the turmeric is different than any turmeric you can buy, because most turmeric you buy has I'm cheating because these words are hard for me. So sometimes I got to read it. Has curcuminoids, which research shows has poor bioavailability. Now, I do know what that is. Bioavailability basically means your body, how well it's absorbing something, okay? So if it's poor bioavailability, it means that it's not absorbing it very well. And doTERRA is the first to combine turmeric extract and essential oil into that dual chamber. That's why that cool pill where you can see it has essential oil in it of turmeric. So it has the curcuminoids, but it also has the essential oil, which has tumerones. So it has your whole plant. And research shows that increases bioavailability and absorption. And it also lasts longer, like more than twice the amount of time in your body. And this is going to help you have a healthy inflammatory response and help you feel less pain, right? Okay, I know this. So maybe related to pregnancy, because I had 9 pregnancies, maybe not. I had bulging discs, and this combo that I do is amazing, and helps me to be able to function well and not be in pain. Okay, so recap. You are going to use your pillows for good support, both in between your legs when you sleep and behind your back. You're going to use your deep blue. You're going to take your bone nutrient or another calcium magnesium that you love, and you can do oil layering with copaiba, frankincense, and deep blue. And you internally are going to support your body and lower inflammation by taking your deep blue polyphenols, your copaiba, and your turmeric. All right, you all, comment below with when you're due and where you live. Like my video. And if you need help finding the doTERRA essential oils and supplements, go to my website, healthymidwife.com, and leave me a message. I look forward to connecting with you, and I would love to help you so you can have a happier, healthier pregnancy and a more comfortable pregnancy. Thanks. Talk to y'all later. Mwah.